times get hard, and we're here to help at NorthPoint.
Welcome to another episode of NorthPoint Making Health Happen. My name is Lisa Castile, and I am your host for the program. Thank you so much for tuning in today. This series is being brought to you by NorthPoint Health and Wellness Center. We want to connect with you about topics in health and wellness that impact our community. And we want to provide you with practical tips and resources you can use. Today we will be discussing joint health and aging gracefully with Dr. Mark Garnett, who provides chiropractic care to guests here at NorthPoint. Thank you so much, Dr. Garnett, for appearing on the podcast today.
Well, it's a pleasure. Thank you for having me.
Yes. So tell us about Dr. Mark. Who is this guy, the person?
This is a guy that, in college, I did not know what I wanted to do, but I knew I wanted to help people. Okay. And kind of became a professional student along the way just because I was a little lost. And all of a sudden it hit me, and it hit me because I had injured my back when, in college, and I went to a chiropractor and turned my life around. Okay. So I had gone to I did physical therapists, a whole bunch of doctors. My mother happened to be a physical therapist, and nothing was working. So a friend of mine said, well, hey, why don't you go see my chiropractor? And I said, at that point, I was like, okay, I got to go. I got to do something.
You got to try something.
Because this pain is killing me. And I went after the first adjustment. It was... it was amazing. It was a reduction in pain by about 50%. Wow. And that was just one visit. Right. So I said, well, maybe there's something to this. So I changed my educational path at that time. Wow.
So, it impacted you that much? You just switched?
That much. I mean, pain is... It's ugly.
Yes, it is ugly. Yeah. It is ugly. Well, that's amazing. I came to chiropractic care in a similar way, and I think I'm so glad to have you on the program today because not everybody understands what it is, what the benefits are, because they, don't get exposed to it. It is an alternative form of medicine, yes?
Yeah, I mean, I would say that, at one point in time, it was considered alternative. Now, with the collaborative model that we have, it is playing a much larger role. And a lot of the providers, especially here and that I've worked with elsewhere, look at chiropractic as being a vital part. Okay. Playing a vital role.
The narrative has changed.
It has. And it's still changing. There's still work to be done. But the stigma of the past is no longer there.
Good. That's good. So tell us, what is chiropractic care? What's all involved?
Wow. Well, it's about innate health. Okay. It is about, mind, body, and spirit. And kind of a philosophical approach, a lot of science behind that as well. But we feel as though when you are injured, usually there is a structural component with that. Okay. And being a chiropractor, that structural component for me is the spine, the nerves, the bones, and the role that they play. Okay. And it's really about, let's say if you were to fall and you injure your back, there are structural changes to the body. And those structural changes can have effects and often negative effects on the nervous system. Okay. So it's really about relieving that, what chiropractors call that subluxation within the body, and that's just that disrelationship between the bones, nerves, muscles, and those things that run your body.
Okay. Now I want you to make this plain because I think I know what you're saying.
It's kind of a long-winded answer.
I'm of that age where stuff just kind of does its own thing, right? Yeah. So when you say structural, are you talking about things moving around in your body and that's why you need the adjustments? Can you talk about that a little bit more?
Correct. So let me give you an example. Okay. You go to bend over and you throw your back out. Oh. A lot of people know what that is.
Yes.
But it could be things like a disc herniation. It could be a pulled muscle in the low back. When those muscles and discs become injured, it irritates the nervous system, and that will cause further pain. It's kind of a cascading effect.
Yes.
So you have pain and muscle spasm and antalgic posture,
Wow.
and you're miserable.
This is making me think of that song that we learned when we were kids. The hip bone is connected
Oh,
to
yeah.
the joint bone, or whatever that. I don't remember for
Right,
sure, but
right.
but this is like what you're talking about. Yeah.
Exactly.
Okay.
Exactly.
Okay.
And those changes within the vertebral column, that structure that I have that I brought with me behind us, your brain is that's the computer that runs your body. And if one of those vertebral segments, one of those bones is impinging on your nervous system, that can cause a lot of things from, pain to neural deficit to problems with, your bowels,
All of those
the
things.
way you think, headaches. I mean, a bunch of things are associated with that. So my job is to really identify what the patient is dealing with and link the specific vertebral segment to that,
Okay.
and then remove that subluxation complex.
Okay. So we're going to talk today about joint pain and adults and how that chiropractic care can help aid in some of the things that we see as we're getting older and we're trying to age gracefully, right? So you work with some specific populations here at NorthPoint, right?
Correct.
Okay. Can you tell us a little bit about that?
Well, we work with everything. So my background is family practice,
Okay.
athletic rehab, nutrition,
Okay.
a bunch of things. So our population here ranges from everything from, obstetrics to pediatrics
Okay.
to adult care to senior care as well.
Well, let's talk about adult care and senior care, and specifically around joint pain. How can chiropractic care complement other medical treatments or therapies that adults and seniors might be?
Sure. And I think the most powerful part that chiropractic plays is that holistic piece.
Okay.
Okay. And it is providing the patient with the control to make a difference. Okay. So if we can improve neural function or biomechanical function through a set of stretches, through what we call a chiropractic adjustment, and that can keep that patient active and mobile, that's the key.
Sure.
Because it's really all about quality of life, right? So, people come and see me. Most of the time, they're in discomfort. They're in pain.
They come in for
Exactly.
Yeah.
Exactly. And my job is to identify the cause, treat the cause of that complaint. And if you can get that right, if you can identify what's causing that, chances are those symptoms will go away.
right. And in your case, like you said, the first time, 50% reduction in pain.
Exactly.
Which is pretty powerful. And I experienced that
Exactly.
as well, because I obviously believe in chiropractic care and its benefits, and just that holistic approach that you're talking about.
Yeah.
Yeah.
Yeah, and it's important. I mean, I think that, and a lot of people would agree out there that, right now society is definitely, we are over-medicated.
Say it.
So you're taking pills for this, that, and the other, and
Yeah.
all of those things. There are side effects to all of that.
Yep.
Okay, and I've got a large, ratio of my population here that's been there, done that, and it's not working for them.
And they're looking for alternatives.
So they're looking for exactly. what's a viable option? What haven't I done? Because at times pain, especially chronic pain, can make you desperate.
Yes,
right?
absolutely.
You will do pretty much anything. Let me try anything just to get rid of this. And instead of turning to, pharmaceuticals, and they do have their place, okay? But instead of going back to that allopathic model,
Sure.
okay, we give patients a viable alternative.
Okay.
Okay.
Right.
And I think most people, once they, after the second or third visit, they've got that small glimmer of hope that, wait a minute, I do have a reduction in pain. I am feeling a little better. Okay. And once we get them to that point, then we can go on and say, okay, now let's focus on everything else.
Sure. So tell me a little bit, we live in a place where there's extreme climates. And, I think as a result, too, when you get older, like it dawned on me one day, oh, this is why people live in Florida. Because my body just hurt, it was just hurting.
Right.
And a lot of us, as we're aging gracefully, we experience that, right?
Yeah.
So can you tell us a little bit about how much, lifestyle, environment, all of those things factor into some of the joint pain and things that we're feeling in our bodies?
Yeah, that's everything, right? How you eat, how you eat, how you think, how you drink, everything that you put into your body, either there's a positive or a negative to that. So eating healthy, staying well hydrated, getting proper sleep. This is a society that we live in right now where, it's pretty stressful.
Yeah, it is
right?
stressful.
Well, how are we coping with that stress?
We're binge watching.
Right. Some of us are, some of us, turn to, what have you.
Yes.
My thing is I love to go to the gym and just work out those stressors there.
Yeah.
But, what are your healthy outlets?
Right.
And what are you putting in your body? Because that really affects, the changes that you see, those outcomes.
Sure.
So in the case of, if you're eating poorly, let's say, patient comes in with headaches. Okay, well, why do you have headaches? And after a thorough history, I find out that, they had a fall.
Oh.
And they
don't even think about that.
They don't even think about it.
Okay. Yes.
And so we do the exam, we figure out, there is misalignment in the neck, in those vertebrae. And those vertebrae are irritating the nerves in that area, which is then facilitating the headaches.
Look at that. Mystery solved.
Well, yeah,
Okay.
and instead of throwing a pain reliever at that, and that pain reliever masks the symptom, but it does nothing for the problem.
Okay, I love that. Right.
So that's really what chiropractic is all about. Is can you, when a patient comes in, and I know a lot of the staff think my exams may take a little while, but it's important to talk to your patients, get to know your patients, and to figure out what they're dealing with,
right,
and their history. Once you have that information, then you can move forward with the correct plan.
Okay. So when someone comes to see you, Dr. Mark, and you talk about that, your exams, what's involved? What can I expect?
Sure. So you come in, other than a witty personality, you've got a pretty intensive history, and then a physical exam. And then that physical exam, we've got range of motion, we've got various orthopedic, neuro, and chiropractic exams that, or tests that go along with that. and then it's my job to take all of that information and make make a good diagnosis.
And then from there you come up, do you do a treatment plan? Like if,
Sure. Yeah, you
Okay.
so once the exam is done, I will write up a treatment plan in between, that visit and the next time I see the patient. And sometimes, I'm unable to finish that treatment plan at that time. Why? Because I need to send you out for either lab work or X-ray, MRI, to give me more information.
Okay.
To make that diagnosis.
Yeah, you're really solving the mystery and looking at all the angles. And
Exactly.
then after someone would start treatment, what are some additional things? Like, do you give them stretches? Do you talk to them about diet? Do you refer them to like our dietitians? How does that look at NorthPoint?
Sure. And that's the wonderful thing about an environment like this, because you've got it's the perfect model, right? You've got multiple practitioners, and we do work together, and that's what makes the relationship so great. Is that if I have a patient that I need to make that referral for let's say nutrition, what have you, I can make that. If I need to send that patient to mental health, I can make that referral too.
Sure.
Because it isn't, you have one person and, you've got multiple little sections and we
Right.
can treat them separately. No, you have to treat that human being in its entirety,
Yes.
in their entirety,
Yes.
right? So, after we do the treatment plan, take a look at all the data, and then I will make the proper referral.
Okay.
Yeah.
Okay.
Hope that answered your
No,
question.
that totally does. So when we're talking about our adult patients, our seniors, what strategies do you use to kind of empower them to take more of an active role in managing their joint pain and overall wellness?
Yeah, good question. So my job, other than being an educator, I think one of the biggest roles I play is that of cheerleader. My job is to play the advocate, right, and make sure that the patient is getting what they need for success.
Sure. So that they can live, and with the goal of, like you said, living a healthier life, being able to do things that, you see those commercials where, like you said, it's like there's some kind of medication to help you, be able to do activities with your grandkids or, but they have side effects.
Correct.
Yeah. So this is something that we want our community to research a little more, come in, learn about it. Do you do any type of educational seminars here at NorthPoint? That
Not yet.
Well, hello.
Not yet, but
let's get that going.
Yeah, a lot of that stuff I've done in the past, but it's a new environment.
Yeah,
I've only been here for a little while, but
Okay.
yeah, that's on
How
the
long have you been with
that's on the
NorthPoint?
radar. So I just started. I came on full time in the fall.
Okay.
So right around September, I think it was.
Short time. Yeah,
So-
because if you you like education, you're an educator, and again, like I said, so many people are unfamiliar with the benefits of chiropractic care, and then being in this environment where whole person care is one of our pillars.
Correct.
Absolutely, we should take away some of the stigma and the scary stuff. Because I'm going to tell you, the first time I went to a chiropractor, I was scared out of my mind, but I was in pain, and giving up that control of having someone
Right.
adjust you, and you really have to. Once you've done it, I think you learn how to breathe and. Just you have to let it go, right? You have to trust your doctor in this process, but that's difficult for some people.
And it is. And you're absolutely right about that. And the thing that I see the most is with the patients that we see, especially our patients of color, and I hate to say it, but they're not always treated with the most compassion.
Talk about that.
And
Yeah.
and just from what I've been told and what I've experienced myself, as a black man in this country, I go in and see my doctor, sometimes you're not treated as well as you think you should be.
You really
right?
have to advocate for yourself
You do.
in that environment.
You do.
Yes. Yeah.
So I think in this environment, patients can slowly kind of let their armor down.
Sure. Absolutely.
And we have to give them time to do that in space.
And build that trust.
Yeah.
Yeah.
And I think once they do that, we can move forward. And most of the patients, after the second or third visit, it's pretty intimidating, pretty scary. But once we talk and they get a little more comfortable, it smooths out, and we're cruising at 30,000. So
okay, good.
Yeah.
So, is there anything for someone listening today, a message that you'd want to give them?
Yeah, the most important thing is, one, we care about you, and two, there is hope. There is hope. I've had a lot of patients come in and, hopeless, right? They're, nothing's worked. They've tried everything, and we're able to make a difference. And just, if nothing else, with just, care, love, dedication, and letting them know that, hey, this is a safe place.
Yeah, absolutely. And don't be scared.
Yeah, don't be scared. I mean, I'm not gonna bust you up too bad.
Not too bad. All right. So, Dr. Mark,
okay,
you're a fun guy. I can tell from the short time that I've spent with you that you're a great guy. Tell us a little bit about yourself. What do you do when you're not here at NorthPoint? What's your jam?
So a lot of things.
Okay.
So I love Latin dancing. I've been dancing for 10 years.
What?
Been doing a lot of traveling throughout the world with that, and going to different congresses and workshops.
Okay.
And so definitely a passion.
I would have never thought this
Oh yeah.
about you. Latin dancing,
surprise,
ladies and gentlemen.
surprise.
All
Yeah,
right.
surprise,
okay.
surprise.
Okay, what else?
Love motorcycles.
Okay.
So
Now, do you like distance riding? Are you part of a
I don't do a lot of the distance riding.
Okay.
It's more kind of track riding,
Oh.
high speed stuff.
Okay.
But I do.
What kind of bike do you have?
A couple.
Okay, a couple bikes.
Yeah.
Okay.
So one is a sports tourer that I take on longer rides,
Okay.
and then a track bike. That
nice. Yeah, you can get
Yeah.
out there and experience
love the speed.
the outdoor. Wow.
Yeah.
Okay.
Yeah, that's my relaxation.
So we got salsa
zone.
dancing,
Yeah.
and we have motorcycle riding.
Yep.
Okay.
Love the gym as well.
Okay.
And
Working out.
yeah,
Yep.
little
Yep.
climbing and hiking and
Okay.
outdoorsy stuff.
Okay.
Yeah.
Okay. And
Yeah.
what do you do to keep yourself informed about the current trends? And because you seem very, well versed in your field, do you continuing education, seminars, that kind of stuff?
Yeah, lots of CE stuff. So I'm usually in different workshops over the weekend, just learning more, a little bit about my profession, nutrition, acupuncture, kinesiotaping. I mean, I've done a lot of different workshops that just kind of, it's good to keep the tools sharp.
Yes,
And
absolutely.
to stay up on things. So constantly doing that. Love to travel.
Okay. What are
So-
some of what is your top place that you've been in the world?
I think the most impactful was my trip to South Africa.
Oh my gosh, I just got back from South Africa in April.
Robben Island was crushing. That
Was it not?
Yeah.
Oh yeah, that blew me away. I
yeah.
cried.
Yeah, it brought me to tears. I was like, wow. Stood in this cell right next to Mandela.
Yes.
Yeah.
And we had one of the former prisoners give us the
As
tour.
your guide, yeah.
Wasn't that was crazy? South
yeah.
Africa is an amazing place.
It is.
Yes.
Yeah, the
beautiful.
continent.
Did you go on safari?
We did.
Yes?
Yeah, we
Okay.
did. So that's the first,
Nice.
and seeing it on,
Yeah.
seeing it on TV and in person.
Yeah, it's totally.
two
You
different
can't
things.
explain it really.
You
Just it's so
cannot.
the beauty is the vast. Just the mountains.
It's breathtaking.
It's gorgeous.
Yeah.
It's gorgeous. Yeah. Cool.
Yeah.
All right. So you like to travel, all of that.
Mm-hmm.
Let me ask you, because we talked about this a little bit, but how would you make someone feel better about coming in? Let's say someone's listening right now and they're thinking about it in our last couple minutes here, but they're kind of hesitant, they're nervous. What would you do to make them feel better about this process?
I would just let them know that they could just simply pick up the phone, especially our existing patients, just pick up the phone and say, hey, I'd like to schedule to see the chiropractor, and they'll get you taken care of.
Easy as that.
Easy peasy.
Okay,
Yeah.
wonderful. Well, we appreciate you being on the program today. We've enjoyed talking to you and learning more about what you do.
Yeah,
Good.
this has been fun.
All right.
Can I come back?
We'll have you back.
Okay.
Yes, and look, I'm waiting. I want you to do those seminars. I'm not kidding, Dr. Mark. I'm waiting for that now.
I've done lots of those.
Okay.
Yeah.
Well, you need to bring those to NorthPoint. We have an executive conference room for you, conference center over there. You can just,
All right.
schedule some stuff up.
Okay.
Yes. Thank you for listening to this week's Making Health Happen. We want you to know that we're here to partner with you and to help make health happen in your life. To learn more about NorthPoint, call us at 612-543-2500 or visit us on the web at northpointhealth.org.
When you walk through the doors,